Hello there and happy Wednesday. I am running just a few minutes behind here. It is Wednesday and Wednesday evening update. I'm really excited by all of the questions that I have gotten about functional tics. And so we're going to dive right into your questions. I'm going to try to answer them. I'm going to share a lot of literature and ideas for treatment too. That was probably the biggest question I got about functional tics was treatment. So I know I've got some of my fellow therapists here wanting to know, what do we do? But I also got a lot of questions about what is it? How do we know it's a functional tic? How do we distinguish that from something else? So that was the post that I shared today. So I'm going to share a lot of visuals for you all. So I created this based on several resources that have been recently published comparing the most common tic disorder, which is Tourette syndrome, with functional tics. Somebody even asked, like, how do I know it's a tic versus dystonia or something else? So from a movement disorder language, tics are fast, they're repetitive muscle movements. They can also be vocal, that occur very suddenly. They're very difficult to control. And so that's a tic. That is distinguished from something like dystonia, which is often a sustained, but also repetitive, but slow writhing, a more slowly moving, twisting movement, often happening in the hand, the foot, or in the neck. That is dystonia. So you can have idiopathic dystonia or functional dystonia, or you could have Tourette syndrome or functional tics. And functional tics became much more widely seen during the pandemic. It doesn't mean necessarily, at least that we know, that there was an increase in them, but they were definitely more noticed during the pandemic. And there's been a lot of research on functional tics that has come out since the pandemic because they were more widespread. So when people have asked me the question, how do I know if it's a functional tic? There are some key pieces. And in fact, just today I found that, let me pull it up actually for you all to get the name right. It is in the European Journal of Neurology. The European Society for the Study of Tourette Syndrome actually put out diagnostic criteria just a few months ago for functional tics. So I'll share that with you as well. But if we're just comparing and contrasting to what we typically see in movement disorders is Tourette syndrome. And this is typically an insidious, slow onset at a very young age. There is a male predominance. And so one of the characteristics of a functional tic is a more rapid onset and typically at a later age, and it's very disabling, whereas and not to say tics and Tourette syndrome are not disabling, they can be very disabling, but they don't interfere with function as much. They often have a rostrocaudal progression in Tourette syndrome and start in the face, so rostral to caudal, and in functional tics, they often start in the body and the arms. They're suppressible. Now, sometimes functional tics are also suppressible, but less so. Functional tics also tend to be more prolonged. That's often what I see as well. And they can also cause injury to the person themselves or to somebody else. So those would be some of the ways to distinguish them. And again, I just found this today, so I'm going to share it with you all, which is diagnostic criteria that have been proposed from the European Society for Study of Tourette Syndrome. By the way, are you on our newsletter? Because I'll send out the links. I've got a ton of links from today, a lot of literature. I'm going to put this in our newsletter. If you're a clinician, you can sign up at reactiveeducation.com. If you're a patient, sign up on reactivept.com. But I'll send out all the links to all of these papers in that newsletter like I do every week. So let me go to these criteria that they proposed. So in this table, I'm going to pull it up here too. They're proposing 3 major criteria and 3 minor criteria for functional tics. The major criteria, based on those things that I just shared, the age of onset, the rapid evolution of the symptoms, and what those symptoms look like, the phenomenology. Also, 2 minor criteria, the comorbidity profile and having other functional neurologic disorders. I want to show you one other piece here from another study. I know lots of studies, but this is all really helpful. I think when we can understand the nature of a functional tic, we can better understand how to treat it. So one more article. Again, this just came out, Journal of Neurological Sciences, neurodevelopmental versus functional tics, a controlled study. So they actually were looking at this and comparing groups of Tourette's neurodevelopmental tics versus functional tics. And what's really interesting here is, I'll just show you a table from this study as well. Let me pull that up. Oh shoot, it's cut off. Let me describe this, the findings here. Let me see if I could pull this one up. Kavana and colleagues is the article, and what you can't really see here, but they have functional tics, and then they did age matched, gender matched for folks with Tourette syndrome as well. And some of the big differences were things like the presence of ADHD and obsessive compulsive disorder. These are very common in Tourette syndrome, not common in functional tics. But you know what is autism. And this is something that we're seeing really commonly in functional neurologic disorders. And this was much more common in functional tics than Tourette syndrome. I think this is really, really important because it gets down to the treatment as well, because I really firmly believe we can't just treat a symptom. We really need to work with the entire person. And if that person is autistic, we need to take that into consideration and what that means from a motor system standpoint, from a sensory system, from autonomic as well. So all very important parts of managing tics. Some of the other things that this study found was the presence of functional seizures did not occur in Tourette syndrome, did occur in functional tics. We often see those side by side, functional seizures and functional tics, along with functional movement disorders, dystonia, tremor, paralysis, and so on. One other piece from here was a family history. So in those with tic disorders, let me look at it, 46%, that's actually the kind of top one, 55%, 46 of the 59 people, that's 55%, had a family history, whereas only 7% had a family history with functional tics. So as a clinician, these would be the questions that you would be asking to help understand the person in front of you. Are they presenting with Tourette syndrome, or is it functional tics? Or again, it could be both, right? So that really gets to the question that somebody asked of, how do we know? Like, what is this? How do we know it's functional tics? And another question that somebody asks is it curable? And hold on one second. I meant to stop sharing here for a moment. So let's talk about that. And I think about this with many disorders where people actually ask me if I have a cure. I don't have cures for things, but I certainly, as a physical therapist who works on an integrated team, I have lots of ways to help people have a very full and complete life with a neurologic disorder. Now, I think the better question is there treatment? Can it be managed? Can people who have functional tics go on to live without any tics? Absolutely they can. I've seen it, and it definitely happens. A lot of people with functional tics can go on to live without the presence of functional tics. I don't know that I would say it's a cure. I would say that people have then learned about their nervous systems and what they need and are able to regulate better so that they don't have functional tics. So that was in response to the question of, is it curable? I want to make sure I get to all your questions, by the way. Okay, how to treat. How can we help somebody at home? Does it contribute to other symptoms? All really, really great questions. And this is where there is not a study on treatment of just functional tics. And I'm going to be really honest, I have not seen a person with functional tics who didn't also have many other symptoms. So whether that be that they had they also had functional seizures or dystonia or tremor or functional paralysis, or maybe another neurologic disorder or migraines or hypermobility or autonomic dysfunction, often all of the things at once, right? So that tends to be what I see. So I don't know that there is going to be a study just on functional tics. I've never seen them in isolation without other functional neurologic disorders or, frankly, other health conditions. So and there's no study on it. There are studies on treatments for Tourette syndrome. I'm not going to go into all of those today. There's some medications, there's treatment for obsessive compulsive disorder, and there's some cognitive behavioral therapies that can be helpful in Tourette syndrome. Those have not been studied in functional tics. And in fact, some of the things that might be helpful for Tourette syndrome might not be as helpful for functional tics. So let's talk about treatment. And you know that we can't really talk about treatment of any functional neurologic disorder without zooming out and thinking about the whole person. I didn't even bring a picture of the pie chart. If you've joined us before, when we zoom out, we're often really looking at the whole person through our pie chart, where we look at distinct parts of the person and the nervous system to see what might be underlying the functional tic symptoms. Some of the biggest things that you would look at. So Lily is here. Lily, this is for you because I know you asked about treatment. Lily loves the pie charts too. Some of the biggest pieces of the pie that we see for functional tics are in the sensory system and the autonomic system. Now we know the other systems really influence that. So psychosocial does, lifestyle does, motor does, but the pieces that I have seen been most beneficial for the person with functional tics is assessing. So first we need to assess it, the sensory system and the autonomic nervous system. One of the pieces that I love to start with, and there's many ways to look at this, but I love this one. It's the river runneth over. This was something that Chelsea from Re+active, Mike Studer, myself, and Carly Lockala, when we presented a few years ago at a professional conference, we put this together to look as an illustration of nervous system capacity. And where you see this river running over, that overflow can manifest as a functional tic or a functional tremor or a seizure or weakness, or pain, or dizziness, or brain fog. And so when we think of treating functional tics, we actually really want to understand what that person's nervous system capacity is at, what the regulation is like, what are the contributing or triggering factors. Is it fatigue? Is it sleep? Is it something in the environment? Is it inflammation? Is it trauma? Is it sensory input? Find sensory input being a really big piece for tics. And then what our job is in rehabilitation is to build up nervous system capacity, whether that's digging the river out a little bit more or putting in some sandbags to build up the sides. We can build nervous system capacity. Some of the biggest ways we do that is through sensory training and through autonomic nervous system training. And I will tell you, the biggest piece of that for me and on our team is with occupational therapy. I'm not gonna lie, I love our OTs, and I think they do such a tremendous job at assessing the person and their sensory profile. So we use the sensory profile as a way to understand that person's sensory system. And then we can use that to guide treatment. What sensory input does that person need? What do they maybe need less of? This really helps us guide treatment. So Lily is even asking, and I think I'm answering before I even got this question, how do we assess the sensory piece for functional tics? Is it our typical sensory exam? It isn't really our typical sensory exam. I dove right into the sensory profile. A few years ago, that was not at all part of my sensory exam. Occupational therapists have been using this for a very long time. It's something that I really just learned and got introduced to over the last few years. But it's really understanding the integration of the sensory systems for the person. So you could do some of your traditional sensory testing, but I have not seen that that's a direct correlation to functional tics. I have seen that sensory integration is. And we see this, the literature has shown our great colleagues at Mass General, our OT colleagues there, Julie McLean, Jessica, Jessica, I'm so sorry because your last name just escaped me, but really great OT group has published extensively in this and have shown differences in sensory profiles for people with functional neurologic disorders. And what that means is that person has sensory needs that need to be met, or their nervous system is overflowing and they have functional tics. Those needs might be vestibular, they might be proprioceptive, they might be sound related, they might be light touch related, they might be smell, they might be taste. And this is why it's not surprising to me that study found a higher incidence of autism in those with functional tics, because we see this in functional neurologic disorders. Folks with autism have sensory processing differences. And so testing that, again, I like using a sensory profile and then treating that. And if this is out of your zone of genius, which it was truly for me a few years ago, this was not my area of expertise. I needed to learn a lot. I needed to learn a lot about sensory integration. I needed to also incorporate learning on interoception. I'm still on that road of learning. I think OTs, again, much of what I'm learning is from OTs, by the way. I think they do a phenomenal job at this. And I truly think I wouldn't do this work without having an OT on our team who is helping and understanding, assessing, and treating this. But as a PT who is new to this, and maybe you're flying solo and doing this, I would start with looking at understanding what that person's nervous system capacity is, and what are some of the things that lead to overflow. What are some of the sensory things? Sound, vestibular, proprioceptive, touch. What are some of those things that might lead to overflow? What are some of the autonomic pieces? So this is another piece of nervous system regulation. What are some of the autonomic pieces that might lead to overflow? So here I'm going to assess the autonomic nervous system. I'm going to look at heart rate variability. I'm going to look at exercise tolerance. I'm going to look at movement tolerance. I'm going to look at their blood pressure and heart rate through various positions. And then I'm going to train it. One of the greatest things that builds nervous system capacity is movement and exercise, but not if a person can't tolerate it, and not if their nervous system is already overflowed. So we may have to use some autonomic regulation techniques to get to the point where the person may be able to exercise and move more, because that exercise and movement truly builds more capacity in our nervous system. So that's where, if you are a therapist that's not familiar with sensory integration, doesn't know where to start with that, I think you can start with The River Runneth Over. I think you can start with exploring sensory and autonomic pieces with that person to where they may know and understand what might contribute to this nervous system overflow that is bringing on the functional tic. Now, I did want to show a couple of pieces because this shows you a couple of other areas you can intervene. So these are the last pieces, I promise. I know there's so much in this. There was one other article that I will share again in our newsletter, Functional Tic Disorder, a Pandemic in a Pandemic. And they share this, which is very similar to something that I created in functional neurologic disorders. And I'm going to share the one that I use as well. But they share this as a proposed mechanistic diagram of functional tics, including predisposing traits, which might be genetic factors, epigenetic factors, interoceptive awareness, social cognitive traits, maybe prior life events. Add on to that precipitating factors, so maybe psychosocial stressors, social isolation, for example, during the pandemic, physical stressors like inflammation or actually getting sick with COVID, exposure to tic and tic-like behavior. So this has come up a lot from a social media perspective. It doesn't mean it's all that, but they list that as a possible precipitating factor. And then what you can see is this kind of cascade of events in an adolescent leading to this explosive onset of tic-like behavior. So I want to take this and I want to share the one that I created and have been sharing for a very long time about functional neurologic disorders, and it applies to functional tics as well. And that is, how might these happen? It's a very similar thing of predisposing and precipitating factors of an initial event, or more likely an accumulation of event. And then you have these neuroplastic factors. And this is where I think you can intervene. And this is really, really important in the recovery and improvement of functional tics. Are there sleep pieces, inflammatory pieces, joint mobility and proprioceptive pieces? Are there autonomic pieces like POTS, postural orthostatic tachycardic syndrome, that you can intervene on? Because all of those that might have led to the development of the functional tic can actually help in the recovery and improvement of those tic symptoms. And that is exactly what therapy does. So I think you can really think of, for this person, for this individual, what are those things that might have contributed and led to the development of the functional tic, so that you can get down to the underlying mechanism in your treatment. Lily asked here, what are your go-to autonomic regulation techniques that you teach? I always do breathing and vagus breathing techniques. Brilliant. Yes. To me, breathing is one of the simplest, and it's easy for me. I actually use it during an assessment just to see if things change with that. I will tell you, it feels like almost 50% of the time that makes it worse for people. So the breath work doesn't always work. And for 50% of the people, though, it does really help. It's such a simple autonomic regulation technique, and I absolutely love it. A lot of times, what I think and see that happens with breathing is that it's very internally focused. And we know in functional neurologic disorders, and it's same in functional tics, that the internal body focus can amplify the tic. In fact, I talked to a patient today, and he's like, if I think about the tics, they get worse. Yes, that is the definition even of a functional neurologic disorder. So if the breathing is bringing too much focus to the body, it can be really helpful to bring the breath externally focused. And so this, I would say, for me, has been my go-to starting for breath now, is breathing with an external focus. Even if it is simple as something on the belly, and it's just that you're going to move the object on the belly, or if you see videos of us, we're always blowing bubbles because they're externally focused exhale. By the way, the exhale is the piece that is so key for increasing parasympathetic drive. So exhale with bubbles, or a balloon, or blowing an object. All of those things have been really nice. So you have an external focus with your autonomic. Something else that has been really helpful, and again, this is very person specific, is movement. So repetitive, rhythmic, rocking movement. That could be in a rocking chair. That can be swaying side to side. It can be singing and humming with a song, which also can be a really calming activity for our nervous system. Again, this is person specific. If a person has a sensory sensitivity to sound, we might not be turning on music and rocking. So as always, I know you asked, Lily, what are your go-to autonomic? It's so very person specific. I was thinking particularly of a person that I saw today who had functional tics. And one of the things that was just so helpful in the moment doing the consultation was very careful listening, slowing down my responses, talking really calmly. I wouldn't say I have a super soothing voice, but because I get really excited about things, but I just think I slowed things down in the moment. And that was because the person said and shared with me, hey, I'm really anxious talking about these things and it makes my tics worse. And I was like, of course it does. And of course you'd be anxious talking about these. So let's slow down and bring your cat. Oh my gosh, Lily, one of my go-to things is pets. If they're there, I often work on telehealth and the person's at home, so I get to see their pets, and it's really, really amazing. Now, put a cat on your lap and you have sensory input. It's proprioceptive. There's a them, so they can be very regulating. Pets can fill up like the riverbanks to make the river deeper. So we brought in the cat during the session today. So just another, and this was just a consultation I had with a person, and I just wanted to see what in that consultation, what was possible for them, what was soothing for them. So it was a way just in a conversation that I could see what was helpful for them. And this was all on telehealth. I think the other thing I would have done if we were in person was maybe try some weighting. And again, it would have been nice to have a sensory profile. I didn't yet have a sensory profile on this person, but my guess is that maybe some weighting would be really grounding. Maybe we would even do a grounding practice. So one of my favorites is just with an external object, and I have all kinds of objects here, but like identifying the textures and the outline and the course. You know what's a really great object, by the way, is like a credit card. This is not a credit card, it's my AAA card, but having something like that, running fingers over it, seeing if you can identify things, it's a grounding and mindful activity, and that can be very regulating to the nervous system as well. So you asked, Lily, those are some of my go-to from an autonomic nervous system standpoint. And some of those things can be really little. Some of them are a lot bigger, like adding weights and rhythmic movement. And sometimes we're doing all of them at once. If you see that one of those things is not helpful, it doesn't mean it's not helpful entirely. You might just need to layer on other pieces. So let's say the bubble blowing or the breath isn't helpful, but what if you added that with movement? It's why I love yoga. Yoga incorporates breath with movement. So maybe the breath with movement is really regulating. Maybe you add the external focus to the breath. And before you know it, you have layered on maybe 5 or 6 sensory and autonomic activities for the person. Another thing that is really regulating and helpful when it comes to treatment is play. Now, I don't just say this for kiddos. This is for adults as well. And every time I'm in a consultation with a person, I just had a couple today, so this is fresh on my mind. I'm really investigating and trying to understand that person's sense of play, what brings them joy and purpose, and how then I'm already thinking, how can we bring that into the therapy setting. Play is so underutilized for our adults, and this can be really, really helpful when it comes to managing functional tics and building nervous system regulation. It's not just a distraction technique. I think a lot of times therapists think, oh, well, that's like distracting, so now they don't have tics. No. I mean, yeah, it is distracting, but that's not the purpose. The purpose is nervous system regulation. And I'll go and I'll finish here. This is a very long video today. I'm just going to pull up our River Runneth Over one more time. When we think about play, when we think about sensory activities, when we think about building up exercise tolerance, when we think about helping a person manage dysautonomia, all of those things are building up their nervous system capacity. And play is a really big component. So it might be distracting in the moment. Yes. It might allow more automatic movement. Yes. But in the long run, it's actually building up the riverbanks so that person has more capacity. And then what you see and what we see is as that person has more capacity, they are less triggered. They have less tics. They have less seizures. And maybe no more tics, maybe no more seizures, maybe no more tremors or dystonia or paralysis. We really see this gradually over time as we build capacity in so many different ways. But I gave you those two today, thinking about the sensory system and the autonomic nervous system. And again, I will say it over and over again, I think it takes a team. I think I could make a little dent in the river alone as a PT, but I think with my colleagues, occupational therapy, psychology, yoga therapy, I think this is where we build up massive rivers for people's nervous system. And that is what's helpful in functional tics. So again, we went through a ton today because I got all of your great questions. I'm going to send out this video, and there were like 4 or 5 articles that I shared today, all the way from diagnostic criteria to comparing and contrasting functional tics with Tourette syndrome. I'll put that all in our newsletter. You can join the newsletter at reactiveeducation.com if you're a clinician, or reactivept.com if you are a patient. And I'm going to leave you with one other resource. Oh my gosh, I forgot about this. I'm going to share this in the newsletter as well. This is from neurosymptoms.org, and John Stone had put together this lovely Venn diagram of functional tics and Tourette syndrome. What's really important here, I kind of went through the differences. Notice the overlap. There are a lot of commonalities. And this is true not just for functional tics, but functional dystonia, functional tremor, functional Parkinsonism. Functional neurologic disorder, it's a neurologic disease. It has a lot of overlap with other neurologic diseases. And so it is important to distinguish what is this, but also to appreciate the overlap. So I'll share this resource as well in my newsletter this week. I didn't want to forget about that. So thank you. Thank you so much. Keep the questions coming. I will continue to share posts and videos and treatment ideas and live videos. I'm going to go live on Friday to talk to Frida, who is a person with a functional neurologic disorder. I'll do that on our Facebook page at lunchtime, my time, so you can join me there. And thank you so much. Thanks for caring about this and continuing to be on this journey of learning with me. So have a great evening, and I will see you soon.